It's just very powerful being back in this room and coming back in here to do the work. I spent so long sitting just over there, actually, that chair over there. First of all, being wheeled in my wheelchair, so I couldn't even move the wheelchair myself, and then being, sat at the table and food being brought and wondering what the hell was going on in life, looking out of the window, looking at the world going, wow, that looks amazing out there. How am I going to eat this food? How am I going to go to the loo? Where am I? All this sort of stuff. I've done a lot of diverse things in life, DJing at big festivals, being involved in the fashion industry in Paris and New York, and snowboarding, and I've lived a bit. And then I had a serious stroke, and by battling and surviving a stroke, I wittingly went to the University of Life and got a strange qualification in stroke survival, which enables me to talk to others and help others on their path dealing with their stroke. When I was on my road to recovery and doing quite well here, I would talk to other patients and we would support each other. So I think we're trying to offer some aspect of that patient-to-patient support, which can only really come when you've been a patient. And some of the patients are sort of, wow, you're back. Okay, how come you're back here? Because some of them are desperate to get away. And they don't realise they're actually in the best place to be. And we can offer these really deep messages just by coming back. We see patients in the sort of more acute environment in Brighton, and then we would meet them again here in Hayward Heath. And that continuity of a friendly face is very strong and very important. Making sure you're thinking of individuals rather than a sort of an overall scheme has been key. So the personalisation of the care, if you like, I think has been really a key factor to the success of the project. And in my early involvement with it, in fact, I remember being at a couple of meetings and sort of saying, look, these meetings are great, but we need to get some work done as well. And that's about people supporting people. We're helping to steer the project and recognising the needs of the team. I think the role could be best described as being more like a team captain, because a captain of a football team or a hockey team would be on the pitch. I think the project had flexibility from the start, and that was made clear, which is one of the reasons I found it exciting to be involved, that the company was agile enough to find a new employee like me and say, actually, we think you might have something you can bring here, and also you have some flexibility. So an example would be having a group meeting could be a barrier for anyone, let alone a stroke survivor. So very early on, I realised that having two health builders in the room at the same time was a really good thing to do, because then they could have dialogue if the room was otherwise awkward. And here turned around and said, that's great, we'll do that. Sitting there as a stroke survivor, possibly in your wheelchair, not knowing if you're going to walk again, which is my position. I wish I'd met somebody who was wandering around, who'd had a similar stroke. You're desperate to know what your future's going to be like. And stroke health builders offer an example of what your future could be like. I think it's as simple as that. We had the opportunity to double the number of groups per month. A measure of success of this project is that we could have doubled the work. Some of the impact has been remarkably strong, almost incredible. That we have individual cases of people who've had very little hope, and then turning around within weeks and had gained strength and determination to carry on. I think the key factor is hope that we can bring just through our own presence. So we've learnt how you can run a team of health builders, lived experience people to support other people. So if we improve patients' lives through hope, then if we can increase the happiness of patients, and happier patients are less demanding on the system. There's a part of you that never really admits that you're the person who's ill and needs help. What about the person that used to run and jump? And there's part of you that doesn't need help and can earn their own money. So to have a role in a project like this has been very empowering for everybody involved. There was an innate need for all the health builders within each individual to try and offer something back, because the NHS system has worked for all of us, right? Just has. So it's been great to come back and put something back in. Why I want to help people so much? I don't know. I think we all do. I think it's a natural thing to want to help individuals.